For this video, we're going to talk about diagnosing lumbar spine dysfunctions. So there's two types. There's type 1 and type 2. Like we said, they kind of follow Fryet's law. So kind of palpating that spine, we'll start with L5. See? Okay. So if you find one in neutral, which you can have the patient bend forward, and it feels normal, and then you'll have the patient stand up tall, nice extend, good, and you don't feel anything, but when they come through that neutral range where they're just the spine's neutral, it's not flexed or extended, you may feel it like rotate to the right, the spinous process. So that would be a type 1 because it's found in neutral, and it's named to the transverse process that's rotated out, that's more predominant posterior. And with these type of dysfunctions, you treat the side bending. So with that, we'll move on to type 2 dysfunctions. And for type 1, you kind of check throughout the whole spinous process because you're more likely to find it in more than just one. And then for type 2, say that we're on L4 here, the spinous process, they feel normal, and you have them slouch for you, and say you feel that right lumbar spinous process kind of come out and it's more predominant, then that would be an extension lesion. So it would be ERS, which is rotated and side bent to the right if that right spinous process is more predominant, because rotation and side bending work in the same direction when the spine is bent. And with that being said, we can have you go back to neutral. Type 2 dysfunctions are, if you find it in flexion, it's an extension lesion, and if you find it in extension, it's a flexion lesion. And then you can have them extend back. Say you're still in that L4, you don't feel anything, you kind of have them go back to normal. Good. And then you kind of move yourself up to, you could have them go into flexion. Yep, slouch. Good. You don't feel anything, then you have them go back up into extension. Good. And then you feel that left side become more predominant in that spinous process, then you'd have a flexion lesion because you found it in extension, and you'd name it on the left side. So it would be F, rotation side bent to the left side.